Good morning everyone. Today I am going to discuss about geriatric care. Objectives. At the end of the section, students will be able to understand the knowledge and develop positive attitude towards and apply these skills in teaching practices. Define aging and geriatric. Discuss about general principles of geriatric care. Enlist the risk faced by geriatric. Enumerate the physiological changes in aging. Explain preventions. Discuss about National Program of Health Care Elderly. Describe role of community health nurse in care of elderly. Introduction. Geriatric is the branch of medicine concerned with the diagnosis, treatment and prevention of disease in older people and the problems specific to aging. Geriatric nursing involves catering help to older adults at their homes, hospital and special institutions like nursing home, psychiatric institutions. Definition. Aging can be defined as a progressive generalized impairment of functions resulting in a loss of adaptive response to a stress and growing risk of age associated diseases. It's given by Grickwood 1996. Gerontology is the study of old age and the process of aging. The field of gerontology is quite broad and involves many different aspects related to aging. It can focus on physical change, mental change as well as social change associated with aging. Geriatric is the branch of medicine that focuses on health care of the elderly. The main aim to promote health and prevent disease and disability in older adult. Geriatric is the branch of medicine dealing with the physiological and psychological aspect of aging and with the diagnosis and treatment of disease affecting older adult. Geriatric care has been defined as the medical care of the people above 65 years and older. The scope of this care has been changed to include not just medical needs but also psychological and social needs of people in this age category. Moreover, before geriatric care encompasses a holistic approach to coping with aging and its effects. The following general principles of geriatric care. Consider individuality, be patient, kind and sympathetic, communicate effectively, demonstrate respect, encourage independence and encourage him to make his choice and decision, assist elderly to achieve emotional stability, stimulate mental acuity and sensory input and physical activity to uplift their self-esteem, self-concept and confident. Make elderly stay in home interesting and lively. Provide diversion and occupational therapy. Maintain privacy. Handle them gently. Make them comfortable by providing comfortable bed and linen. Encourage them to maintain body hygiene, thus regulate body temperature. Assist them to take care of visual, auditory and dental aid. Protect from injuries, falls and accident, etc. The risk faced by geriatrics are prone to infection and injuries, degenerative disorders, psychological problem, increased risk of diseases, increased risk of disability and risk of death. Physiological changes with the aging, general status, progressively decreasing efficiency, physiological process result in a fragile balance and hinders the body ability to maintain hemostasis, physical or emotional stress, adjust problem. Changes in the face, colored spot on the face become thin, drier and develop wrinkles, earwax become drier, eyebrow and eyelashes become grey, the eyelids become loose and wrinkled, shrunken eyes present, cornea may develop greyish white ring called arcus corneus or arcus sensils. Aging changes in hormone production, thyroid gland become lumpy, osteoporosis, the fasting glucose level rise 6 to 14 mg per dl, cortisol secretion decrease, aging men experience slightly decreased level of testosterone and women have decreased level of estrogen hormone after menopause. Integumentary system, loss of skin elasticity, pigmentation changes, glandular atrophy, thinning hair, slower nail growth, atrophy of epidermal arterioles, wrinkling, dryness and scaling are common, hair losses, loss of melanocytes, sebaceous gland produce less oil, it resulting itching and dryness of skin. Changes in immunity. Immunity power is decreased due to more chance for infection. The immune system ability to detect and correct cell defense also declines, which result in an increased cancer associated with aging. Sensation changes, guide changes in the skin structure. Diabetic, which also more common with increasing aging, can lead to decreased immunity. Respiratory system, decreased cough reflex, decreased vital capacity, increased chest wall rigidity, increased airway resistance, increased risk of respiratory infection, decrease in lung capillaries. Cardiovascular system, a slight increase in size of heart, arrhythmias and atrial fibrillations, thickening of blood vessels and narrowing of vessel lumen, loss of vessels elasticity, lower cardiac output, decreased elasticity and calcification of heart valves, increased pulmonary vascular tension, increased systolic pressure and decreased peripheral circulation, blood pressure higher which lead to hypertrophy, RBC and HB levels are reduced. Gastrointestinal system, loss of teeth, decrease in saliva, decrease esophageal peristalsis, malnutrition, anemia with reduced muscle tone, constipation and indigestion. Musculoskeletal system, bone loss, decreased muscle mass, decalcification of bone, degenerative joint changes, bone demineralization, joint tend to stiffen and lose flexibility, range of motion decreased. Neurological system, brain and spinal cord lose nerve cells, loss of weight, decreased neurotransmitter, decreased impulses, cognitive and behavioral response delayed, decreased reflexes responses, decreased temperature. In ears, the drum often thickens, bone of middle ear affected, loss of acuity for high frequency tone, thickening of tympanic membrane, abnormal ear noise. Taste buds decrease, mouth produce less saliva, digestion slightly less. The smell sense of smell may be diminished related to loss of nerve ending in the nose. Touch reduced or changed sensation of pain, pressure increased pressure ulcers. Genitourinary system, the number of filtering unit and kidney tissues decreased, blood flow to kidney decreased with diminished cardiac output, decreased bladder and sphincter muscles control, nocturia, polyuria, kidney and bladder cancer. Reproductive system of female, menopause, decreased estrogen and progesterone hormones production, degeneration of ovaries, atrophy of vagina, uterus and breast, vaginal wall become less elasticity, thinner and less rigid, reducing breast size, decreased number of mammary glands. Reproductive system of male, diminished sperm count, decreased level of testosterone hormone, enlargement of prostate. The changing sleep pattern is diminished. The psychological changes is loss of memory, decreased and end self-dependence, loss of source of income, incapacity. The preventions, the following preventions are primary preventions, secondary prevention and tertiary preventions. Pre-geriatric care, health education, exercise comes under primary preventions. Annual periodical checkup, yearly detection of disease treatment comes under secondary preventions. Home help, meals and wheel services, counseling, rehabilitation, old age home care comes under the tertiary preventions. National programs for health care of the elderly, according to government providing accessible, affordable and high quality long-term, comprehensive and dedicated care services to the aging people. Creating new architecture for aging to build a framework to create an enabling environment for society for all ages, to promote the concept of active and healthy aging, convergence with the National Rural Health Mission, Ayush and other line department like Ministry of Social Justice and Empowerment. The role of community health nurse, the care of elderly, provide direct health care to the elder people, educate and train caregiver to the care absence of the nurse, supervise the care given by carer, nurse educate elderly to more self-dependent, nurse maintain accurate, precise and complete record of care given to the elderly. Thank you. Any doubt?